Good morning, everyone, and welcome to Unique Not Different with me, Shamla. I would like to say thank you for with the greetings. That caught me off guard. So thank you so much. So today I have Mr. Kenneth Surratt, Executive Officer of the Trinidad and Tobago Blind Welfare Association. And this month we celebrate World Diabetes Day. And Mr. Surratt is here to talk about, blindness and visual impairment as it relates to diabetes. So, good morning, Mrs. Surratt. How are you doing?
Good morning and happy birthday to you, and also happy birthday to my wife, Rosa. She's
Oh,
celebrating her birthday today also, so
that's
double 11,
awesome.
and I'm very fine.
That's awesome. Happy birthday to her. So, let's begin, Mrs. Surratt. This year, World Diabetes Day focuses on diabetes and well-being. Why is that message so important for people who are blind and low vision?
Diabetes is one, some years ago, the National Eye Survey of Trinidad and Tobago was conducted, and one of the preventable causes of visual impairment is diabetic retinopathy. That is preventable if you have you adjust your lifestyle. But we at the Blind Welfare Association, while some people may be using the month of Diabetic Awareness Month to prevent blindness, we at the Blind Welfare Association have quite a number of persons who are either one, got blind because of diabetic retinopathy, or two, because of lifestyle. And some years ago, the life expectancy of persons who are blind was around age 60. So in the early days when the British had they had the pension, persons who were blind were able to get pension at age 40, old age pension, because of the life expectancy. That law has changed, and persons who are blind are in the same category as quote unquote persons without disabilities. So, we are the Blind Welfare Association. We want to encourage protecting. If you have a little vision, yes, you may be in the spectrum of visual impairment, because visual impairment is a spectrum of total blindness, severe visual impairment, mild, moderate. So, let's say, for instance, you are in that spectrum. We are saying with good lifestyle, you could preserve the vision that you have. And we are calling upon the government of Trinidad and Tobago. There's something called continuous glucose monitoring.
Mm-hmm.
Persons who are blind, it is difficult to use the needle to stick your finger, put it on a strip, and put it in a machine. Thank God for technology. Persons who are blind, there's a patch you can put on your hands, and you can monitor your glucose in real time with an app on your phone that is accessible. And yes, it is costly, but persons who are blind or persons with disabilities, we live on an average person, they live on an average income of $2,000 per month. No way they could afford that. So we are asking the government to please make it accessible for persons who are blind to monitor their glucose level.
With that one question, you beat out with that one answer, you beat out two of my questions, which is fantastic. So for someone who are already living with blindness, what does diabetes management really mean?
Okay, like for instance, someone who live in diabetes, sometimes the nerve endings, if you don't manage it, you could
Mm.
be not as sensitive. And remember, you depend on touch. Besides braille, you need tactile learning whatever you're doing. So we are suggesting that persons with that who are blind and also have diabetes to manage your diabetes so that the nerve endings they remain as sensitive as possible. That is good health. Watch your diet and so on. And again, we are looking at, you're living on $2,000. How much of that can you use to really live, to eat healthy? And we are very concerned about that. And before the budget reading in Parliament, we did communicate, right, the Ministry of Finance and our line ministry to please consider increasing the disability grant.
Right. And again, you answer one of my questions, but I'll still go more in depth, right? What support or partnership is the Blind Welfare Association working on to make these tools affordable? Because you mentioned that they are the tools, but if that is accessible, but it is not affordable or available.
So we are also besides the government, we are looking at the private public sector, also the Diabetes Association, because there's a serious case of there's something called an injection. I want to make it in simple terms that persons who have diabetic retinopathy for their eyes, that injection is only available in the private health system. It is not available in the public health system because they said it is an off-label drug. An off-label drug is where you have a drug for a specific item that approved by WHO, but it is also used for something else and it have benefits. So this is your anti-VIGF drug and injection that can be used to reduce sight deterioration. We are asking the Minister of Health, please add it in the health sector so that persons who have diabetic retinopathy could slow down the deterioration of the vision by getting this injection. This injection is very expensive outside, something like $1,000, $2,000 for this injection, and you need more than one. We
Yeah.
need it in the health sector, and we've been raising the issue. I raised the issue with the president of the Diabetic Association, Mr. Andrew Dano, and he is interested in also supporting us to have this injection part of the 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 treatment that doctors in the public health sector could use to help reduce blindness. More sight we preserve, we
Yeah.
reduce our social impact.
And just quickly, right? What are some simple steps can anyone take today to protect their health and stay independent while living with diabetes?
The simple thing, get moving. As all tell persons who are blind, when you get blind, you tend to move less or you tend to move slower. Because one, your health and safety, you don't want to get injured or bounce thing or slip or fall. Simple thing, if you have a step in your house, practice going up and down that stairs, put aside 10, 15 minutes.
Right.
Or if you have a driveway, start moving. Then start eating, fresh fruits, vegetable, you know, you know, lower your carbohydrate intake. And I hoping that one day, just like how they teach dealing with banning cigarette and increasing alcohol price and so on, serious consideration should go towards increasing sugar intake, heavier taxes on sugar. We need to reduce our sugar intake. I have a friend from the States, when he come down here, he said, Trinidad, I don't like to add sugar in the juice. He always like, the juice as is. Whatever
Yeah.
kind of juice, don't add sugar to it. Drink it naturally. And Trinidad, we have abundance of fresh fruits and vegetable. Support the local market. Stay away from foreign fruits and so on. We have better fruits in Trinidad and Tobago. Find out some fruits that your grandparents used to eat that the more way of. Let us go back to eating fresh fruits, vegetables, and keep moving.
How can persons reach out to the Trinidad and Tobago Blind Welfare Association?
Via email, ttbwa1914@gmail.com. You can WhatsApp us at 395-3086 and someone will get on to you. We are encouraging persons come to the Blind Welfare Association. All our services are no cost to you, and you could benefit a lot from using technology and meeting persons who are blind and lifting your own expectation.
Mr. Surratt, it's always a pleasure to have you. It's always appreciative of your support on my segment, and it's always a knowledgeable time when you are here. So thank you so much for this. And I think it really, no pun intended, that eye opener, as diabetes linked with blindness and visual impairment. So thank you so much.
Thank you very much for the opportunity. And you don't worry about that because I always tell people once you are blind, you always keep in touch.
For sure. Definitely. Good one. So, guys, with that being said, I want to say thank you so much for tuning in to this week's segment of Unique Not Different. As I always say, be good, do good. Bye, everyone.
Bye-bye.
I hear you sharing all kind of